Great. Okay. And now with that, I'll hand the mic over to Tam Perry from Wayne State University, who's going to serve as our next MC and eventually as our discussant. So go ahead, Tam.
Hi, everyone. Thanks so much for coming. We're very excited about today and the possibilities of where this kind of workshop can go in the future as well. Next slide, please. So we wanted to think about our event today in terms of, we wanted to convene what we are calling global thought leaders on aging in community, or aging in community, to explore work on community-centered initiatives and aging equity. And we hope the different talks we share will lend itself to provoke your own thought and becoming your own thought leaders, as many of you in the audience are already thought leaders. Next slide, please. So we wanted to think about who's in the room. So we thought we'd use the chat for you to just let us know and hear the guiding questions. But I did a look of who registered for the symposium today. We've had 222 people register. I hope some come today. And they're from all over the globe. So we have Manchester and other parts of Europe strongly represented. We have Canadians, we have people from Asia and South America, as well as the United States. So we're excited about that. The other thing is I really looked at who, when people listed their identities, I think we also have a nice range of researchers. Yes, we're from the research community as well. A lot of us think of ourselves as gerontological researchers, but we have practitioners, architects, community health workers, care managers. There's someone who's labeled the director of social connection. I love that. As well as older adult community members and community residents. And I actually loved the description of community resident in the sense of we're all part of many communities. And so we can think about that as we introduce ourselves as well. Thank you so much for coming. It's great to see people listing their backgrounds. Next slide, please. So here's our overview. We hope you've given an hour and a half or maybe an hour and 45 minutes of your day to this summit. So we thank you. I think I'm doing the welcoming remarks, so that's good enough. We're going to have 3 presentations, then I will also some discussant remarks, and we'll have a Q&A. So let us know if you have a question, either put it in the chat or raise your hand. Then we thought part of this virtual summit is to meet people we haven't met before. So we're going to have breakout groups. They're totally random. Let's see if it works. And then we'll come back and Emily will have some closing remarks. We thought maybe people might want to stick around and meet the speakers. If you do, we're here. And so this program will end after number 5 in an hour and a half, but we're going to stick around for a few minutes in case anyone wants to say hello to us. So with all that, I think we'll get started, and I'll turn it over to Tina.
Hello, everyone. Can you see my slides okay? Excellent. Thank you so much. I'm just trying to get all the things that are showing up on my screen out of the way. Thanks so much for joining us today. My name is Tine Buffel, and today my talk is going to be based on the work of the Manchester Urban Aging Research Group, and also based on a book we collaboratively contributed to, which is called Reimagining Age-Friendly Communities. So this is what I will cover in my presentation, a short introduction, some background and critiques of age-friendly cities, and how we think a spatial justice lens can drive age-friendly efforts forward. The Manchester Urban Aging Research Group, which I lead at the University of Manchester, is an interdisciplinary group dedicated to improving the quality of life and reducing social exclusion for older people in urban areas. And we work together with policymakers, communities, older people to co-create age-friendly communities. And I've noticed quite a few people are on the call, so hello and thanks for your support tonight. Why focus on urban aging? We all know that population aging and urbanization are reshaping our communities, yet older people are often erased from urban planning. Their needs and voices are overlooked despite the critical role of home and neighborhood in later life. And one approach to urban aging is the age-friendly city framework, introduced by the World Health Organization to create more inclusive and accessible environments that support people's well-being and participation as people age. It's a framework that encourages cities and communities to prioritize accessible housing, inclusive transport, safe public spaces, and opportunities for social inclusion, whilst also encouraging cross-sectoral collaboration and involving older people in city planning. But as we'll discuss, it also has its limitations, and I think we need to really look critically at how we can make this type of work more impactful. And this slide shows the global reach of the Age-Friendly Cities initiative. Over 1,600 cities and communities in 53 countries have joined the WHO Global Network since its launch in 2010. And whilst the approach has gained traction, most members, as you can see, are located in the global north with varying levels across cities and communities of sustained commitment. And the network's growth has also occurred amidst economic recessions, austerity, shrinking welfare states, often reducing services for older people and limiting cities' opportunities to create age-friendly cities. Now, much has been written about the vital contributions of many age-friendly programs, but here I want to explore how we can address some of its limitations. And one of the major critiques is the lack of robust evaluation, with still a limited understanding of really what works for whom and in which context. And this is despite progress made by key researchers, including Emily Greenfield here on the call, but also others who have done work on monitoring and evaluation. But I would say the picture remains rather patchy. Our study, for example, of 7 cities across the world looking at age-friendly programs, we found little effort to assess the real impact, which really made it difficult to scale, adapt, and justify further investment of age-friendly city programs. Another critique is that without explicitly addressing social, economic, racial, ethnic, and health inequities, age-friendly initiatives very much risk reinforcing these disparities. Age-friendly programs, as we know, often depend on existing infrastructure and funding, often benefiting better resourced areas, whilst under-resourced communities lack capacity and resources to implement meaningful changes. Systemic racism, which has deepened since the age-friendly approach was first developed, must be given much greater prominence in addressing these inequities in the age-friendly movement. And age-friendly initiatives have often also struggled to reach out to those with long-term health conditions, people experiencing frailty, dementia, all of which highlight the need for much more inclusive strategies, whilst also aligning with broader rights-based movements such as disability rights and others to promote equity. Thirdly, the age-friendly movement has also largely overlooked the political economy of cities and the broader forces like gentrification, migration, displacement, housing precarity, and climate change, which all significantly impact aging populations. And finally, many age-friendly initiatives still tend to rely on more tokenistic forms of participation, offering more symbolic rather than really substantive involvement. And what we argue in the Manchester Urban Aging Research Group is that what is needed is more radical approaches that really center older people's rights to the city, challenging existing power structures and giving communities real influence. In our book, we argue that the concept of spatial justice may offer a valuable lens to push some of the ambitions of the age-friendly movement forward. And spatial justice connects ideas of social justice on the one hand and space, building on thinkers such as Harvey, Soja, Feinstein, and challenging us to confront how inequalities are embedded in urban environments. Reimagining cities as sites of fairness, where resources and opportunities are equitably distributed. And importantly, spatial justice also prioritizes those most affected by environmental pressures, including gentrification, pollution, rising costs, and pushing back against these kind of unchecked urban developments, whilst envisioning a more radical age-friendly movement where older people and communities have real power to shape their cities with rights-based approaches and justice at its core. So this edited collection is structured around 3 key parts. The first of which explores the background of urban aging and introduces the spatial justice concept. The second looks at a number of age-friendly interventions in Manchester, showing how they promote or can promote spatial justice in practice. And the third part aims to reimagine age-friendly communities, offering some ideas and alternatives for more inclusive, equitable urban developments. So we asked the authors of the 12 chapters to engage with 3 principles of spatial justice: equity, to ensure that age-friendly policies benefit those most in need; co-production, aimed at centrally involving excluded groups in shaping meaningful change; and diversity, to recognize the varied identities whilst also fostering solidarity and shared spaces. So equity is a core focus of the book, raising questions about who benefits from age-friendly initiatives, who is excluded, and how can these programs really tackle systemic inequities like poverty, racism, and health disparities. Chapter 4 by Nazru examines how patriarchy, class, and racism shape health inequalities in later life, and really calls for action on addressing these root causes of inequity in age-friendly work. Chapter 6 by Kavanagh and Lewis explores how we can integrate age-friendly principles into urban regeneration. And this is a photo from North Manchester where a huge program of urban regeneration is taking place. And the authors of this chapter argue that we need equitable, sustainable, or sustained engagement with residents, whilst also acknowledging the histories of communities, adopting an intergenerational lens, and creating collaboratively inclusive places for different age groups in those neighborhoods being redeveloped. Chapter 8 by Mark Hammond and colleagues examines then how architects perpetuate spatial ageism, excluding older people through some of their designs by prioritizing younger, able-bodied users and reinforcing stereotypical views of aging. And they highlight how participatory design approaches in architecture can engage with different groups of older people to create more inclusive and equitable solutions. The second principle, diversity, urges age-friendly initiatives to better recognize and integrate some of the diverse identities and needs of aging populations. One example from Manchester is the Pride in Aging initiative, where older LGBT residents have co-created a pocket park as a safe and inclusive space that fosters community, belonging, and pride. Also, Luciana Lang's work highlights the role of faith spaces, like, for example, mosques or temples or churches, which often act as vital forms of social infrastructure, especially in under-resourced areas, where They have been shown to support recent migrants, also older people facing isolation or financial hardships. And all of these examples, including the chapters that are shown on the slides, they kind of really show the importance of recognizing and amplifying the work of grassroots organizations and community groups in advancing age-friendly goals, even though those practices may not be labeled as age-friendly as such. The final principle is then co-production. So here the question is how age-friendly initiatives can secure older people's rights, not just to a share of urban space, but also allow different communities to participate in decision-making, shape strategies for urban planning. And here, an example is in chapter 7 of the book, where Goff and Doran explore the Urban Villages project in Manchester, where they really show how co-production, despite its many challenges, especially in under-resourced neighborhoods, but how co-production can foster also partnerships between service providers, older people, and community stakeholders to improve the experience of aging in place in those communities. And last but not least, of course, chapter 11 critiques the WHO age-friendly cities framework, advocating for an emancipatory approach rooted in critical gerontology and Black feminist scholarship to tackle structural inequalities. But of course, two of the authors of this chapter, Emily and Jarmin, are here today, so I'm sure they will be able to expand on those ideas. So to wrap up, here is our call to action for reimagining age-friendly communities. Firstly, prioritize spatial justice by redistributing resources and centering marginalized voices. Secondly, embrace diversity by recognizing diverse needs and fostering solidarity and shared spaces. Thirdly, commit to genuine co-production, working with older adults and grassroots groups to co-create equitable futures. And finally, challenge the status quo by reframing aging as an opportunity to build just and sustainable cities through bold collective action and innovation. Thank you. And these are a couple more resources that I'd be very happy to share. Thank you so much.
Thank you, Tina, so much for that wonderful overview of all this tremendous work. And thanks to the Manchester group for your leadership and voice in all of this and sharing it with us today. So I think our Rutgers team is up next. So I'm going to go ahead and share my screen. Just a second to do that. Okay. And everybody can see that okay? Okay, excellent. All right, so again, I'm Emily Greenfield, and I'm a professor at the School of Social Work at Rutgers, the State University of New Jersey, and also the director of our Hub for Aging Collaboration. And today I'm really happy to be able to present alongside Clara Scher, who is a PhD, advanced PhD candidate in the School of Social Work, alongside two other PhD students at our institution, Natalie Pope and Uri Amirkoran. We worked on this paper together titled Aging Equity and Diversity as part of age-friendly community practice in the United States. So we're going to share some background, a little bit about our methods, hoping to have most of our time on the results and let them speak and have you all think about it, and then some quick limitations and our thoughts on key takeaways or implications. So where are we coming from? Well, we're scholars, right? We're researchers. So of course, we're coming from a grounding in the literature, many of which you here have all contributed to and created together. But I want to begin by sharing our positionality as part of a community of practice, really honored and pleased to be part of a pioneering initiative in our own geography, which we now call Age-Friendly North Jersey, which is a network or alliance, and this is the words of the alliance itself, a growing alliance of advocates and change makers dedicated to making the communities where we live, work, and play better for longer, healthier, and more equitable lives. And Age-Friendly North Jersey started as a cohort of 8 communities that received grants from 2 local private philanthropies to spur the development of age-friendly community work in our geographies. At the time, there were only 2 communities across the entire state of New Jersey that had joined the domestic U.S. network of AARP and the World Health Organization as the global leader. And there was a sense that we need to collectively spur the efforts and that private foundations have a role to play in doing that through not only giving of financial resources, but also by leadership and organizing people to learn and grow together as they try to advance this innovative area of community-centered work. We are so honored to be in the role as thought partners and practice partners in all of this, but wearing our research hats, we're designated as the kind of developmental evaluators of this grant-making initiative that then blossomed into what we now call Age-Friendly North Jersey. And our role in part was to conduct years-long evaluation work, looking at these initiatives from the ground up, from kind of day 0 as part of the grant-making program, and follow them over time. And the goal is to really understand what the nature of the work is and how they're working. Most of our research efforts with the network have involved conducting annual qualitative interviews with the key leaders of the age-friendly efforts in their respective communities. So this is kind of broadly, doing this work as developmental evaluation, but also positioning it as part of this mushrooming global discourse on age-friendly community work. And the core question is, okay, you can invest resources, and part of it is trying to understand, like, what are those resources? Of course, there's financial resources, but there's non-financial, human capital, social capital, other forms of tangible capital. How do we invest those resources to effectively achieve age-friendly community progress? Like, what is in this black box? And our work over the years has addressed this in a variety of ways. So here's just some examples of some of our work, and we list here the URLs people can go to learn more about this. For example, how do older adults contribute as leaders and participants in age-friendly community change, echoing Tina's reflections on the importance of co-production. In what ways do age-friendly community initiatives achieve long-term impact in terms of systems change? So trying to advance the evaluation work that Tina also noted as a major issue in this area, and so forth. But for the purposes of today's virtual summit, we are going to present our work on this question: how do AFC leaders, age-friendly community leaders, attend to issues of aging equity and diversity in practice? As another really important question that is something that we can learn from this real-time emergent area of innovative practice. And I have to say, this is a question that has been on our mind throughout the years. Like, it's always been a question that we've been wanting to ask more about, learn more about, discuss. And I have to say, it's been super challenging to get to a point to actually be able to feel ready to present this element of people's practice, but we're really proud to have the opportunity to do so today. So some guiding concepts and assumptions quickly. First of all, the concept of aging equity. So our team approaches aging equity as encompassing both equity in aging and aging in equity. So aging in equity can broadly refer to ageism, which I think we're aware of at the structural level, interpersonal level, intrapersonal level, holding certain beliefs, assumptions, stereotypes about people based on their perceived age. But then also that ageism as a system of disadvantage and privilege operates in the context of intersectional systems of oppression and privilege. So all the other isms, racism, sexism, homophobism, and the like, ableism, it could keep going. We also operate on the assumption that there is diversity in aging, especially in the United States. Basic assumption is that older adults differ from each other across a variety of categories, positions, groups, and/or identities, and some are listed here very broadly. We think it's important to note, especially in the context of global discourse, that racism is a focal dimension of diversity. It's a key assumption that we operate in, and inequity, especially in the United States, although not unique to the United States. Racism is a global phenomenon, but in our country, we have, long sordid history of this being a major characteristic of the society in which we all live. And racism is also a focal point of U.S. social work. So all of us on this paper are academic social workers, and our, U.S.-based professional organizations center racism. It's not that racism is the only system of oppression and privilege that is of an orientation, but important in our discipline to call it out and to make sure it's included as a focal point within these discussions. So we share that context as well. So important to note that as we work with the interview data, we did qualitative interviews with the leaders of these this cohort of 8 age-friendly community initiatives. The project wasn't designed as a study of this particular aspect of their practice, but at these 3 time points of interviews, we did include explicit questions around aging equity and diversity because we wanted to make sure everybody was invited to reflect on this aspect of their practice. We didn't want to just, say that people didn't talk about it because they didn't think about it or they weren't asked about it. Everybody had a chance at some point in the interview to be asked an explicit question around this topic. And we asked about it in different ways at the different time points. So in the spring of 2019, we did group interviews with the age-friendly leaders. We used the term intersectional social positions among older adults in their work, really keying in on that idea of diversity, that older adults are diverse. We also did some probing on considerations of linguistic diversity in different languages people might be speaking in communities. The second time point was in the context of the global pandemic, when there was a lot of heightened attentions, especially to racial disparities and racial justice work. And so we asked them explicitly as a more major part of that wave of interviewing to reflect on how their work at that time relates to racial justice. And we probed whether that was a shift given the murder of George Floyd and other historic events around racism in 2020. And then in the most recent round of interviews, we did one-on-one interviews with 26 of the leaders across these 8 communities, and we asked them broadly to reflect kind of holistically 8 years into their age-friendly journeys, how their initiative has helped to advance racial justice and aging equity over the years. And we did probe at this time on examples where people with marginalized social identities were incorporated into their initiative's leadership structures. We asked specifically about that. So our data analysis was reflexive thematic analysis. We transcribed the interviews, we put them into Deus as qualitative software, and we used reflexive thematic analysis, which involves multiple iterations of coding the data, memo writing, and importantly, acknowledging the subjectivity in the analytic process. So as part of this work, all authors have written reflexivity statements. As a group, we spoke constantly around our positionality, around historical context concerning diversity, equity, inclusion, and how that was influencing our engagement and interpretation of the data. And we ended up doing 3 iterations of coding, beginning with open coding, pattern coding, subcoding. For the sake of time, I'm going to leave that as it is, but happy to discuss those technical details as interest suggests. So quick summary of our sample. We have the community level, the 8 initiatives, plus the 26 individuals who are a part of it. I won't go into too great a detail here, but important to note that the communities they have a relatively high median income, but that reflects the geography in which the initiatives were embedded, the region of the state where the levels of socioeconomic resources tend to be higher, perhaps in an expensive state like New Jersey and other parts of the United States and the state. And I'm going to go ahead and turn it quickly over to Clara to talk through our results.
Thank you, Emily. Again, my name is Clara Scher. I'm a 5th-year doctoral candidate at the Rutgers School of Social Work, and I'm going to be presenting the results of this project. So as you see on the slide, we found 5 key ways in which age-friendly community initiative leaders attended to issues of aging equity and diversity in their practice. And that was through communications to the public, outreach and advocacy to community leaders, engagement structures, community events and programs, and direct services. So I'm going to provide a high-level summary of each of these 5 themes. Go on to the next slide, please. So first theme is communications to the public. So in these communications, age-friendly leaders helped older residents with diverse social positions access information about events and resources. And one example of this was when participants translated their communications, such as their newsletter content, website materials, and their flyers into the diverse languages of community residents. We also saw that leaders wrote and disseminated anti-racism statements following the historic events of 2020, including the murder of George Floyd in the United States. And these statements expressed a commitment to anti-racism and were posted on websites, newsletters, and social media accounts. Then age-friendly leaders also intentionally disseminated information to organizations that they were connected with, that were then connected to diverse subgroups of older residents. And the quote on the next slide really demonstrates this. If we could go to the next slide. We've intentionally reached out to some of the large Black churches, and I've gone to visit them. I've spoken at their places. We've met at one of the big ones. That's where we hold our meetings. Also, the same with the big Orthodox congregation in town. Their rabbi has come to our meeting that we have for clergy. We have a very good relationship with several of the Black pastors. Next slide. The second thematic category refers to age-friendly leaders' outreach and advocacy to key community leaders on considerations of equity and diversity among older adults. We saw that age-friendly leaders describe ways in which they strategically communicated with grassroots community leaders to help them better advocate concerning their own interests. And examples of this included sharing information with residents on how to advocate to state officials on proposed policy changes that affected them, or providing information about grant opportunities, for example, to community-based organizations that served historically minoritized older adult populations. Though we found that much of the leaders' strategic communication also took place through participation in public or one-on-one meetings with local government officials to really advocate on behalf of older adults who have been historically underserved. Examples of this included using data from community needs assessments that the initiatives led to advocate to local officials on behalf of older adults. And another example of advocacy to local government officials was on the next slide, as one leader shared. On Older Americans Month, I spoke to the governing body when they issued the declaration acknowledging older residents. I said, it's wonderful we're doing all of this. There's a lot of great things happening, but we still need to do more. And one is making these meetings accessible to all persons and having things like hearing loops for seniors that are hard of hearing and live streaming their meetings for people who can't drive at night. There are things I keep telling them that need to be done, and I'm not going to give up on telling them. Next slide. The third thematic category involved equity and diversity considerations within age-friendly related engagement structures, which we define as groups like coalitions, steering committees, and advisory groups that serve to regularly bring together individuals and organizations from across the community for the purposes of information sharing and coordinated action. So several of the age-friendly leaders we interviewed reflected on the importance of representation of older adults with minoritized identities on the age-friendly initiatives engagement structures. So on one hand, some leaders did express that they experienced several challenges to engaging minoritized older adults on their committees. Some participants shared that individuals with racially minoritized social identities were not incorporated due to the fact that localities themselves were not ethno-racially diverse, or they could no longer participate due to prior commitments. But that being said, there were several leaders that were very successfully able to engage diverse voices on their advisory committees. And one of the leaders shared how African American women on the advisory committee brought a voice and a passion for their community and fellow community members. And this age-friendly leader went on to share an example of how the involvement of those community leaders increased the authenticity and legitimacy of their efforts to serve Black residents who had been displaced during a natural disaster. And on the next slide, we have a quote from that leader who said, "It made our efforts seem more authentic that we weren't just the white folks coming in, that it was really a community effort, and I think they respected us for that. They gave us legitimacy within the Black community. When we sat down with the residents one-on-one to find out what they need, we went in with a team of both people like me or people from the Black community who were doing those assessments. They saw us all working together in the same purpose and doing it as a group." Next slide. Leaders further described equity and diversity considerations as part of their work in planning and implementing community events and programs. They reflected on how their programming, this could include multi-generational events, community-wide luncheons, and educational workshops, attracted a diversity of participants. They also discussed the ways in which they intentionally considered older adults' diversity, such as by their neighborhood, mobility needs, cultural belonging, and financial resources when they were designing these events. A few initiatives also shared examples of developing specific community events and programs for subgroups within their communities. And as an example of that, we had one initiative who partnered with a national organization to conduct an outreach event about brain health and Alzheimer's disease to the Haitian community. And they helped to ensure that there were culturally appropriate speakers, meeting locations, content, and refreshments at that event. But on the other hand, there were some challenges, and some leaders acknowledged how the social identities of the members of their age-friendly initiative made it in some ways difficult to design events for minoritized or excluded communities. As one leader shared on the next slide, as white people, we are white people, and we can think like white people. We can think like how we were raised. I can bring programming to you based on what I think you need. I think it behooves us to start listening to the residents of the community. Say, what is it that you need, and how can I give it? How can I deliver it to you in a manner in which it is respectful of your culture and respectful of you? Next slide. The last theme referred to the age-friendly initiative's work to create new or improved services. So unlike community events and programs as discrete events or gatherings, these direct services refer to really enhanced and sustained capacity to address additional specific individual specific needs. And leaders aim to improve the accessibility, availability, and appropriateness of these community services for older adults. These services could include transportation services, food security programs, vaccination programs during the pandemic, and the leaders had specific attention to older adults who were historically underserved. And in some cases, the initiative's core team leaders administered those services relatively independently, but in more commonly, we saw that the services operated
I
through
feel
these
like there's instances where you
multi-organizational
can like go to Amazon
partnerships
and be like,
or
okay,
networks.
they're not providing
And
me
as an
something right now
example, leaders in one community with relatively lower socioeconomic status, they created a
because
twice a
it's
month
like
free farmers market, which later evolved into the development of a new food
we shouldn't
pantry
have to
in the
pay for something
community.
on the return trip.
The AFC leaders helped to coordinate the various nonprofit and municipal partners towards that effort to create that farmers market. As one of the leaders from this initiative shared on the next slide, had this team not been together and had we not had the history of working and just building upon the initiative, it would not have happened. The age-friendly initiative and the connections that we've all built together is responsible. I think it's fair to say that it is responsible for all of this starting to flow.
Thank you so much, Clara. You can tell we're excited to be able to share these findings grounded directly in the perspective of practice leaders, years of work of working on these changes and trying to create, identify patterns and create frameworks that give honor to their efforts as well as identify important gaps for both research and practice. I want to quickly note some serious limitations of this work. First of all, it's important to remember it was based on 8 grant-funded initiatives in Northern New Jersey at a particular point in time. We recognize that the age-friendly communities work is truly a global phenomenon, and issues of diversity and aging equity are highly embedded within diverse sociocultural, sociopolitical, national, historical contexts. And what we find here in this little corner of the United States might have limited transferability in terms of what it is and how we talk about it into other contexts. Also, another limitation is that our study wasn't designed of this particular topic, although we asked about it in multiple ways. We think that getting at it through these multiple time points gives enough depth and richness to present what we presented, but clearly it would be important for future studies to look at this more focally, as our other speakers on this panel represent. And then also our sample was largely identified as white women in large part. And we, as on our research team, all identify as white ourselves. And it's important to note that that is an important context limitation. And clearly, to really advance this area, we need people from an even greater diversity of backgrounds, including racialized backgrounds, to be leading this work in practice, research, and policy. That all being said, very quickly, some takeaway thoughts. Overall, I think we found greater evidence of leaders attending to issues of diversity among older adults, but perhaps there was less evidence for their efforts around equity and inclusion. And so disentangling those 3 terms, like keeping diversity, equity, inclusion, of course, they are interrelated, but they're really 3 separate phenomenon, would be important in the design of future research in this area. We think that there's value in inductive studies of AFC practice, highlighting the how of the work. In our data, we found a lot of emphasis on the importance of human capital, like having people on the core team who speak different languages, having people who have a familiarity with different cultural backgrounds or being from different cultural backgrounds as a human capital factor, as well as social capital, having trusting long-term relationships with different leaders in the community representing different subgroups. And this seems to be a thread across age-friendly implementation research in general, the importance of social and human capital for this work, but especially in this context, it definitely resonated. And then finally, just this broader statement that age-friendly is an amazing movement to study as a researcher because it's both simultaneously so top-down, you know, the global organization of the World Health Organization, creating this vision for people across our globe, you know, to pay attention to and think of how they can change. And it's also so hyper-local and bottom-up. And so just really emphasizing the importance of looking at it both ways, especially with an emphasis on ageism at the intersection of interlocking systems of disadvantage and advantage, to blend both practice, theory, and research to give this movement its greater chance of impact and operate as something that's truly for all. So I'll just leave with that, say thank you so much for your attention, and quickly hand the mic over to Jarman for the third presentation.
Okay. Everyone can see that? All right, great. Thank you so much, Emily. My name is Jarman Ye. I'm faculty at the Institute for Health and Aging at UC San Francisco, and I'm a co-director of the Emancipatory Sciences Lab. My talk today is co-creating an LGBTQ+ adult day program. My talk's going to cover two main areas. First, I'm going to briefly contextualize critical urban gerontology and emancipatory gerontology in the city. And second, I'm going to discuss a community-led collaborative response called Club 75. So this slide comes from Chris Phillipson and Tina Buffel at Manchester, who've pushed the field in developing a critical urban gerontology. They argue that efforts around the world to support an aging population, such as developing age-friendly and livable cities, aging in place, and promoting active and healthy aging, are undermined because the bedrock of society is being fractured by widening inequalities within and between cities, polarization between social groups and increased age segregation, austerity and cuts to social infrastructure, and the impact of urban regeneration and gentrification. They've laid out key elements of a critical urban gerontology leading to a need for emancipatory responses. These elements include the political economy of urban environments and how cities are products and drivers of inequality linked to financial and political elites, privatization of public space and land ownership, housing as risk due to increased profit-making by developers and landlords, the rise of extreme cities characterized by acute vulnerabilities and inequities related to climate disasters and displacement, and communities in distress with wider disparities in health outcomes and life expectancy driven by increased deprivation and socioeconomic insecurities. Emancipatory gerontology aims to advance knowledge and the realization of dignity, equity, healing, and justice through individual and collective agency and social institutions. The key tasks to develop emancipatory responses include examining the neoliberal agenda and other forms of oppression and inequality that generate harm, and engaging our communities to envision revolutionary alternatives. One aspect of this approach is collective action, co-creating cities that are equitable, age-friendly, and resilient, benefiting all generations. An example of this is Club 75, which I will talk a little bit more about in just a bit. Okay, so part 2, rebuilding praxis. In chapter 11 of Tina's new book, Emily, Mel, and I argue for the need to dismantle and rebuild praxis for age-friendly communities. Praxis is a philosophical concept that essentially means linking theory to action and action to theory in a process of thoughtful, practical doing. Code switch that onto implementation science, and we have a critical approach to formative research, which involves collecting and analyzing data before and during the development of an intervention with the goal of identifying areas for improvement to enhance the intervention's effectiveness for the intended population. One such example of this effort is the implementation of Club 75, an adult day program that was created through a partnership between two long-standing and trusted community-based organizations in San Francisco. Open House is a nonprofit that provides affordable housing, supportive services, and enrichment programs for LGBTQ older adults, as well as training for those who serve the LGBTQ+ community. Unlock is a nonprofit that originated the nationally renowned PACE program, which stands for Program of All-Inclusive Care for the Elderly, which provides frail older adults who are at risk of needing institutional placement with the flexibility to meet their health and social care needs while they continue to live safely at home through services covered by Medicare and Medicaid. Just really quickly, this is a launch timeline of Club 75, which somewhat began in 2018, though really the seeds of this project were planted much earlier. In the interest of time, I won't go into too much detail over the timeline, nor will I discuss the specifics of pursuing licensure and meeting CMS and regulatory requirements for PACE programs and adult day programs in California, but just know that that is part of the bigger administrative and bureaucratic picture of doing this work. However, useful to point out is that an adult day program is a specific type of state-licensed non-medical model of care for older adults in California. Open House and Unlock wanted to center the community in the creation of their program, so they called their adult day program a community day services program. However, it was the participants who gave the program the nickname Club 75 because it's located at 75 Laguna Street in San Francisco, and it's a cool place to go where it really feels like the red carpet is rolled out for you from the moment you arrive. This slide is just to illustrate the WHO's encouragement of both top-down and bottom-up approaches to creating age-friendly communities. While these parallel tracks are heuristically useful in their simplicity, actually doing this work is quite complicated. This slide is just to illustrate our own concept mapping of the opportunities and gaps and bidirectional processes at play in doing the intentional work of co-creating Club 75 with Open House and Unlock, from the information gathering to the ideation to the design and to the evaluation phases. And this slide is just to illustrate our mapping of all the intentional relationships, bidirectional processes, power pathways, and moving pieces at play once Club 75 was implemented to again visually demonstrate the complexity, the messiness, and the nonlinearity of doing this work. So just backtracking a bit, the creation of Club 75 really began with understanding the community's needs. While San Francisco is well known for having a strong LGBTQ+ history and culture, it is also true that LGBTQ+ older adults face unique health challenges caused by increased precarity, which is characterized by risk, insecurity, discrimination, and injustices experienced over the life course and in later life. From 2018 to 2019, we conducted a needs assessment involving a review of existing adult day programs and a series of focus groups, one-on-one interviews, community listening sessions, and a market survey. Results indicated high social, physical, emotional, and mental health needs among LGBTQ+ older adults. Several themes arose from our qualitative findings, including the need for affordable healthcare and easier navigation, trauma-informed care, tailored programs and services for this diverse population, and caregivers who needed respite from their duties. As one participant stated, the letters LGBTQIA, on and on, I've always felt the T is different than the other letters. We deal with identity, the others deal with orientation. Our needs, our views are different than the rest of the queer community, especially since we're now older. The key recommendations we heard for the program included creating a one-stop shop for health and social care, inclusive services and programs based on the interests and cultural backgrounds of diverse LGBTQ+ older adults, customized programming to meet their holistic needs, and an affordable program. Although COVID-19 in 2020 caused an initial setback to the implementation of Club 75, it heightened the urgency and vital need of the program too, because the pandemic was particularly devastating for LGBTQ plus older adults who are already living with increased levels of social isolation, loneliness, and grief as long-term survivors of the HIV/AIDS epidemic and other forms of trauma over the life course, as well as having high levels of safety net needs such as service connections, food security, and digital access. Therefore, the implementation of Club 75 was and continues to be an iterative and adaptive approach involving feedback loops between standing up programming, operationalizing processes, and interfacing with participants in a meaningful, person-centered way. Unlock and Open House lean into their respective strengths and assets to co-create Club 75. Unlock's strength is its clinical and cultural competency with the PACE program. Open House's strength is its trust in the LGBTQ plus aging community. By joining forces, the design of Club 75 was to co-create a program that meets the continuum of care needs of LGBTQ plus older adults by providing them with opportunities to socialize, stay mentally and physically active, get help with nutrition, reduce isolation, and prevent decline in their abilities. As a Club 75 staff member explained about the inception of the program, there's just an opportunity to play in this middle space, to do some other model where long-term services and supports are going to be somehow funded more cohesively than they are today. A quick glance at the preliminary outcomes of Club 75 includes high levels of satisfaction with the program, meals, facilities, staff, affordability, and transportation. Over half the participants attended Club 75 to see their friends or not to be lonely, for the arts and crafts, and to take exercise classes. 100% of the participants felt happier and more satisfied with their lives because of Club 75, and the majority had more energy, ate healthier food, learned new things, made new friends, felt better about their health, had something to look forward to, were more physically active, felt more engaged in their community, and knew where they could get help if they needed. Themes from our qualitative findings included increased sense of having a safe place, decreased sense of discrimination and stigma, reduced loneliness and depression, and an increased sense of belonging. As one participant said, "We need a safe place. Club 75 is that safe place. The staff here are sincerely enthusiastic, caring for us. We got cantankerous attitudes because we all been through something traumatic, and this is a place to call. I'm so thankful for being here. I want you guys to know that this is a prayer that's been answered. It's somewhere to go that's safe in a social surrounding of LGBT people." Because adult day programs are typically funded by private pay, there's no other insurance funding to cover the cost of services for Club 75 participants who are not PACE enrolled. Fundraising, individual donations, or foundations have helped subsidize the cost of Club 75. Therefore, the business model for Club 75 needs to have a certain percentage of PACE enrolled participants in the payer mix. From a budgetary perspective, setting targets for that percentage will be important for tracking when Club 75 will become a sustainable model. On the participant side, they were overwhelmingly in support of keeping Club 75 funded. One participant shared, "It helps us be unbroken. At least we're unbroken over here. And when we come back in the morning, we get fixed all over again." Another participant endorsed, "Keep it funded so we don't have to go away. You need gay people. I need gay people around me. I'm all right. Straight people sometimes get on my nerves because sometimes I want to share stuff and they think it's nasty, or they go and pray. One thing I hate is don't pray for me, things like that. So please don't let it go away. That's it. Not until God takes me. Thank you." And so just to wrap up, our lessons learned is that innovation and collaboration takes time, trust, shared vision, political will, and advocacy, which are reinforced by these notions of liberatory consciousness, allyship, and accountability. Leadership needs to be aligned, and I mean formal and informal leaders from the top to the bottom and across functions. And leaders need to be adaptive to changing circumstances, maintain humility, and be open to listening and learning. The program needs to have a flexible infrastructure and diverse funding streams to be agile to pursue different opportunities or to withstand times of hardship. And lastly, it's important to have a gerontological imagination to see the interconnections of this work from micro to macro scales, from the past to the present and to the future. As one Club 75 staff member put it, it's to really live the language. And these are our partnerships with Unlock and Open House. And gratitude and appreciation to the participants and staff. And that's my contact information. And I'll pass the mic back over to Tam.
Thank you, Jarman, and all the speakers. Fantastic talk. I think we should just cheer as we pull up my slides. I just want to say this collection of talks and our ability to come together today is an amazing experience. Thank you, Jessica Finley, for acknowledging. I hope that we can leave you with inspiration for the future as well. So I was just thinking about Tina's work and Jarman's as well, and just how we all need a pocket park, maybe in Manchester, maybe not. But this idea of a safe space. Also, of course, Jarman talked about Club 75, and I love that quote, it's a place that helps us become unbroken. And then, of course, Clara and Emily talked about going to places where people feel safe, which is going to leaders talking about going to churches, etc. So I think that's the first thing I was thinking about. The other thing the talks really talked about was sort of the importance of explicit statements about equity or intersectionality. So the explicit anti-racism texts that were produced by some of the project partners in the New Jersey work, the importance of speaking out, and also thinking about dismantling structures of oppression as well. And I think the last thing that was really interesting is about sort of thinking about who needs to be at the table. And I really love this idea of co-production of knowledge, people being there. And there's also caution that leaders themselves bring our own biases, and based on our background, and that Tina pointed out that there's a real risk of reinforcing inequities as well. So when I was thinking about these talks and reviewing them earlier this morning, I was thinking about this concept of structural lag. And for anyone who said, oh, I wish I could read a paper about structural lag, I'll put it in the chat if I can. So it's an old paper, but a goodie. And so next slide, please, Emily. So I just took a quote from Structural Lag. So it was used really on an individual basis, but I think there's importance in the way we can think about this. So I'll just read the quote. In society at large, lives have been drastically altered over this century as a consequence of increased longevity, advances in science and education, the gender revolution, improvements in public health, and other historical trends and events. But numerous inflexible social structures, roles, and norms have lagged behind. There is a mismatch or imbalance between the transformation of the aging process from birth to death and the role opportunities or places in the social structure that could foster and reward people at the various stages of their lives. The lag involves not only institutional and organizational arrangements, but also the many aspects of culture that, in addition to being internalized by people, are built into role expectations and societal mores and laws. For the future, structural changes will be needed if people are to find opportunities to spread leisure and work, as well as education more evenly over the life course, and to make room for family affairs. And I think in a lot of ways, while this was originally sort of thinking about the individual and what they can do over their life course, I think these talks really bring together the need for looking at structural lag and wondering, why are we tolerating it? So, you know, Tina and everyone's approach to like, we need more radical approaches. We need to be pushing the envelope on where we can go with this. And one thing that's really great, next slide, please, Emily. One thing that's really great about today is that we're bringing together beyond the academic circle. And I really appreciate all the policymakers, practitioners, and students on the call as well. So I think I was trying to think this morning, what can we do about structural lag? So I will honestly say, I think the first thing is we still need very serious critical analyses or evaluations of what is going on. And also, are there new structures to understand as well? So I found this great book, I have it right here. It's Martin and Paul's book on aging and globalization. So, you know, on the one hand, we can think about structural lag. And on the other thing, I was reviewing their book today, and I thought, I found this quote that is also provocative, maybe as a way to marry sort of some of these issues. Moreover, if we are to understand what the emergence of these new spaces mean for older people as well, as we think, as the ways we think about later life, it is important that we are clear about what has replaced this former structures of old age. So in a lot of ways, we have both structural lag and new things being created all the time. Sometimes we're excited about it, like the pocket park, like the new services that are innovative and more inclusive. And I also really thought about how everything has a social life. So there's really good work on the cultural biography of things. So I was thinking of things in terms of programs, in terms of housing structures and communities, and lots of things that even if things are created, they're going to modify. I would say Emily and Clara's work showed how people really did modify based on larger world events over time, et cetera. Next slide, please. So the second thing is, I think we need to build professional partnerships. And I'm part of a coalition in Detroit. Happy to talk more anytime about it. But building longevity, Jarman referred to it as well. Time commitments. Are we making progress when we are always getting together and talking about this work? And back, Emily. And so I actually think sometimes it's good to look back on progress because you're in the moment, you don't always think you're making progress. Building trust, several of the talks talked about that. Different communication strategies. I also think it's really important for people, as you build these professional relationships, to go to each other's events and to support each other. And I think this is really important for academics and the Zoom, which is to say, like, your community partners need you to be there before you have a research project as well. How do we question our ageist assumptions in our work, and how do we continue to strive for equity? Next slide. So then the other thing I'm very worried about is workforce. Who's going to go into all this work? How are we cultivating and supporting the next generation of scholars, of practitioners, you know, the wages for some of the work that people are doing, the volunteer work that people give that should be compensated, et cetera. Next slide. So there are different things that we have tried to do to stay at the table in our work in Detroit, Michigan. And so we're always pushing ourselves to stay at the table. And I think a lot of the partnerships as well, Jarman's intense organizational chart shows that understanding where to be and strategizing and showing up where to show up is part of this work. Next slide, please. It's also really, really great, like today, to build sort of even more national networks and international networks, I guess we can say that, because it's really, I think it also reinvigorates your soul to know of other programs around the world. And I hope that some of this work today inspires others as well. Think about collaborating and co-publishing and co-authoring with practitioners. I would say, you know, understand the expertise everyone brings to the table and acknowledge it through formal ways. Next slide would be the end slides. I'm not sure. I think this is the last slide. And then I was thinking a lot about intersectionality. That's definitely a resonating theme in our work. So Kimberly Crenshaw's work, certainly about how identity, we have many ways we have different identities and then how they evolve, and sometimes they're imposed on us. But I also think as we do work with older people, on behalf of older people, or older people ourselves, we have to remember that people have all their lifetime of background as well that they bring to old age. And so I'll just end there. I hope that was helpful. And I was trying to do a number 5. So I said, why don't we just try to hold ourselves accountable to promote equity every day? So we can all try to do that as well. Now we have this idea, I hope that was helpful, to put people into breakout rooms and just have you meet each other.
Do we want to do any large group? We have time if we want to take 1 or 2 questions from.
We have time for 1 or 2 questions as well. And then the speakers will stick around after the breakouts as well. Does anyone in the audience have a question for any of the speakers? I'm happy to facilitate. I guess let us know. Okay.
Carolyn, do you have your hand up? Do you want to unmute?
Yes, I do. A wonderful webinar. Thank you very much. But one thing that I wanted to hear that I think that could help our problems in doing this is to get more involved with the governments, with the city government, with the local people who make the decisions. I mean, we could go to them, we could have plans and everything, but if they're not on our side, it's very difficult to get anything done. And that's just a comment that I have to make. And I didn't hear anything really about it today.
Yeah, Carolyn.
The end.
No, thank you for the end. I think that's really a great point. Tina, do you have a response?
Yeah, I just want to reinforce the importance of this, and I think I should have acknowledged the great work that has been done at the local level in Manchester and the regional level. I would say it is at the government level that they have been at the forefront of age-friendly developments, and it's really our work has been a partnership. I've noticed some of my colleagues from local government have joined the call as well. And I think, yeah, making progress in partnership with governments, but also with community organizations, with academics, with local businesses. I think it's really a matter of bringing these different partners around the table to think differently about how we can improve our communities and involve different groups. So yeah, very important point. Thank you so much.
Yep, and I can just chime in too. Our team in studying the emergence of the age-friendly communities in Northern New Jersey has been very in tune with the role of the public sector, like in terms of the World Health Organization, Model A, or like you can't join as a private citizen, you can't join as a nonprofit, you have to be some kind of administration, some local administration, subnational administration. And so understanding how advocates kind of work from the outside when you don't have a local administration raising their hands to lead this at first and trying to get the administration on board is part of the nature of the work in many contexts. But I'd also say, I think, especially in conversations of aging, we miss the opportunity to say, don't just advocate from the outside, become part of the inside. So I'm curious if anyone here is an elected leader or a policy person who's run for office, who's leading the table, not just speaking at the table. I think it's a really important point. And we've seen even in our context an example of one of our age-friendly leaders who actually run for local office and was able to win in this most round. And she has shared that she finds that as the most natural step for her age-friendly leadership. Her next chapter of being able to make a difference in her community is actually to become part of that administration. So I just want to emphasize that as well.
All right. Thank you so much. I think it's a good time for breakout groups. So if you can hold on, we hope to randomly put you in, and we just hope that there may be slides. You could take note of some of the guiding questions we had thought of as you're in your breakout rooms, such as sort of what resonates with you, today's talk, what resonates with you. How might you build partnerships, etc.? Is there anything surprising that you heard today? And any actionable strategies? So without further ado, stay tuned. You'll be zooming to a breakout room.